show and tell. So today's theme for this section is engaging communities. Join these science communicators and engagement professionals to trace the path of innovative projects that involve working in and with communities to make science more accessible and engaging. Treat your senses by experiencing some of the best SciComm engagement initiatives across the globe. Understand how they evolved from their initial idea and executed it successfully. Youth Against Antimicrobial Resistance, and we have Dr. Mary Chambers, the project lead for this initiative and the head of public and community engagement at the Oxford University Clinical Research Unit. Mary oversees engagement programs in Vietnam, Indonesia, and Nepal. She has expertise in using participatory methods to amplify community voices and bring them into conversations about biomedical research. She is the co-author of a handbook and online course, Practice and Ethics of Participatory Visual Methods. Welcome, Mary. Take it away.
Thank you. Thank you for the warm welcome and the invitation to join your Science Huddle. And it was really interesting listening to the last talk. And thank you for inviting me to share in this tell. So I'm going to be sharing particularly about involving the youth community. So let me share my screen. So good afternoon, and thank you so much for inviting me. I would like to share with you today some experience about a project that has recently been completed, where we were involving young people in the development of a learning framework to support educators and facilitators who are trying to work with children and young people to increase their understanding of antimicrobial resistance. And this was a project that I've done with a big team of people, and I'm just really presenting on their behalf. So briefly, as an introduction, antimicrobial resistance, or AMR, is really an issue of people's choices and of people's behavior, and therefore any intervention needs to relate to the public and needs to involve the public, and particularly all levels of society, and therefore interventions which typically focus on adults, we're trying to expand those to involve children and young people as well. The impacts and consequences of antimicrobial resistance also impact children and young people. However, they're rarely involved with discussions and conversations. They're rarely seen as agents of change. And when they are involved, it's mainly to be recipients of knowledge rather than involved in acting against AMR. And what we found is that this disparity and not involving youth is even greater in the global south. So a group of us were approached by the Wellcome Trust to run this project. We called it the Youth Against Antimicrobial Resistance, or YAAR. And the objectives were, first of all, just to understand current levels of awareness and knowledge about AMR in the global south and in 4 countries in particular. And then to go on and develop a learning framework that could support educators and facilitators who are working with young people. But we were very keen that throughout the whole project that we had young people involved as partners, and we would co-create messages and engagement activities with them. So just a summary of how the project activities and the flow of the project. The phase 1 was really focusing around World AMR Awareness Week, which was November. So last year it was in November 2020. And what we did to work up to that is we set up workshops with young partners. We collected data, or they collected data. We mapped knowledge, and then together with experts, the young people created AMR social media messages and designed engagement activities for that World AMR Awareness Week. In phase 2, we went on to take the data that we'd collected in phase 1 and a literature and curriculum review to develop this framework that could be used by educators. So the team, as I said, came from across 4 countries: Kenya, Nepal, Vietnam, and Thailand. There were 5 sites, which were including both urban and rural sites. And the team was quite broad in that it included AMR experts, researchers, and youth engagement experts. And as I said, it was sponsored by Wellcome's education team and their drug-resistant infections team. So how did we involve children and young people throughout the project? So first off, we had a youth advisory board, and this was representatives from the 4 countries. They were older young people because we required them to have quite a good knowledge of English and to have their own devices so that they could connect to online meetings. And they were involved in giving us feedback on the project planning, identifying key stakeholders, and advising on the engagement plans. We then went on to set up 5 groups of young people in each country who led on the engagement activities. And through them, we took the project to a much wider public. So the survey, we referred to some existing surveys, but they were very UK-centric. So we validated them with a Global South audience. We based them on 4 key themes around antimicrobial as listed here. And then we used a number of different methods to conduct the survey. So we had an online version which was distributed through schools, so through teachers, and posted on schools and youth organization Facebook pages. But we also asked our young youth working groups to share the links, and where we felt that there wasn't a good online presence, so either with primary school students or in the rural areas, we used a postcard or a written survey. And these could be filled out at home, and then parents or students gave them back to teachers. So just a very quick summary, we had almost 2,000 respondents by the end of the data collection. We had most of the respondents came from the 4 countries that we were working in, but there was another 15 countries as well who contributed respondents. And the biggest age group of respondents were in the 15 to 19-year-old age group, but this corresponds to the youth working groups. And so we really feel that it was to do with peers sharing the survey on their social media networks that got these responses. And then we didn't stop there. We analyzed the data with the young people. So they each analyzed their own country's specific data and looked for where there was knowledge gap. As you'd expect, because the cultures and the groups were really different, we had really different engagement activities that were youth-led, and they were really creative. They were really varied. We had people drawing cartoons. We had a wonderful photo competition in Nepal. We had people creating TikTok dances. And all of this was then put out in a very concerted social media campaign during the World AMR Awareness Week. And so we analyzed it just using the social media analytics. And our metrics suggested that the campaign, or we could measure that the campaign reached over 500,000 people in 1 week, which for me, as an oldie, that was really impressive. And it's really changed the way that my group has done online engagement, and that was a massive learning experience for me and some of the other team members about the power of social media. Okay, so we also created a website, and this is still there, and all of these engagement activities were then uploaded on this website. We've now also using it as a platform for the learning framework. And I invite you to go and have a look at it if you'd be interested to see a little bit more about the project. So then going on into phase 2, we took that data collection that we'd had from day 1, and we did a curriculum review, literature review, and used that to draft a framework that was to support educators and teachers. The literature review, we found that there was not very much in terms of peer review papers that were involving, that was particularly focused on children and young people, and therefore we had to, there was very little that was involving children or young people in low or lower and middle income countries. There are some from higher income countries. So we really depended on the grey literature. And what we found was that the initiatives in the global north, there were some, but they hadn't really involved young people in the formative research. And we found that none of the educational initiatives, sorry, I'm getting a bit hot here, none of them went beyond trying to address that knowledge gap. None of them went beyond that of just trying to educate young people and see them as agents of change and trying to equip them to tackle AMR as an issue in their own communities. So we reviewed 12 curriculum across the 4 countries from the primary years, middle school, and then high school. And based on that, we've developed this learning framework, which is now published, and we hope will be useful to educators and facilitators, both in informal and formal settings, who are trying to work with young people. And then in the last part of my talk, I just want to, so the framework content, it's got some guidance on how to use the framework, and then we've split the framework by the 3 age groups that we felt that was linked well with the learning that they would have at school. And then there's a glossary of scientific words to support the educators as well. So the last part of my talk, I really want to share with you some of the review of the framework and review of the project. And we asked, in the beginning, we asked the young people and teachers what they thought of the framework. And in general, they both felt that the progression of the learning framework mapped well onto school curriculum, and the cumulative learning that they would have as children, as young people. So just in the same way as a primary school biology class would maybe perhaps use the term bugs in English and then it would move on to germs, and then by the time a child is 14 or 15, they would be distinguishing between a bacteria or a virus or the quite specific terms. And the feedback was that the framework mapped quite well onto that. One of the negatives was that teachers may need to spend quite a lot of time to create activities to add in this extra lesson, and so that might prevent them from taking it on as an extra subject. And then just asking the young people what were their reflections on being involved in a project like that, and unanimously they were positive about their involvement. they felt that their knowledge about AMR had increased, their knowledge, their capacity and confidence to speak had increased. And there was also a couple of them, I mean, I know it's just reported, but they said that they were really inspired to towards career choices in microbiology or in biology. What they said were challenges was that it was the time commitment, particularly during the school term. The Youth Advisory Board, which were meeting across the 4 countries, said that the time zones were difficult were a challenge. Some weren't so comfortable in front of cameras and online meetings, and that it was the first time they'd worked perhaps in such a diverse working group. And then from our team, what we felt about youth involvement. Overall, we felt that they brought a great energy to the project. But more than that, they really challenged us to use the right language, youth appropriate but accurate language. We felt that the youth created messages would have been more culturally and generationally relevant than perhaps if we had, as a older team, had tried to create them. We worked with a number of researchers, and what we realized is that not all researchers are good at communicating. They're not all good at engaging young people. And going forward, I think we would put a lot more time into training and supporting the researchers as they did that. That it was also did require quite a time commitment from other stakeholders, but overall it was a really positive experience. So our recommendations that we gave to the Wellcome Trust at the end of this project were that young people very definitely need to be involved in and engaged about AMR, but not just as recipients of knowledge, but as agents of change. And that youth involvement should be considered in many more, or should be considered in all youth-focused projects. However, what we felt was an ethical issue was to involve these young people, and then because the funding finished, there wasn't a capacity to then keep them going, whereas they were motivated, they were interested, and they wanted to keep going. And what we've had to do as our separate country teams is find additional funding and try to keep these groups going, because it just felt unethical, really, just to cut them off at that point after having got them involved. So that was our learning from this project.
Okay.
And then, I'm just finishing there. And it was, as I said, a big team involved. So I'd just like to acknowledge the big team. So thank you.
Awesome. Thank you so much, Mary, for giving that very nice overview of your project.